Well, good morning. My name is Bill Purcell, and I chair this Roundtable on Obesity Solutions. And I want to welcome each and every one of you here in this room and those who are watching the webcast to both the Institute of Medicine and then to this Roundtable's workshop on cross-sector work on obesity prevention, treatment, and weight maintenance models for change. As I think it should be clear to everyone in this audience today, the Institute of Medicine has made a major and a leading commitment to obesity prevention. For more than a decade now, the Institute's focus on obesity prevention has led to 10 separate consensus reports with policy recommendations, over a dozen workshop publications, and approximately 50 other briefs, as well as action guides, infographics, and publications in this area. This Roundtable on Obesity Solutions was created to engage leadership from multiple sectors to solve the obesity crisis. Through meetings, public workshops like this one, background papers, and other activities, the Roundtable will foster an ongoing dialogue on critical and emerging issues in obesity prevention, as well as treatment, weight maintenance, and for enhancing and accelerating discussion, development, and implementation of solutions. There are 50 members in the Roundtable. They come from all points on the compass and all points and aspects of this work, and I would ask the members of the Roundtable, please now, to stand. Thank you for encouraging them there at the beginning of our meeting. And now, so that you can have an opportunity to hear from some members of the Roundtable as they express their opinions and ideas concerning especially this cross-sector collaboration, I'd like to show you a brief video.
If the goal is to have a culture of health in America, then that means that we have to all come together.
Obesity is one of those issues that we really need to address as parents, within the schools, within the community.
1/3 of all of the adults in the United States are obese. 1/3 of all of our children born today will develop type 2 diabetes. Over $190 billion. That's more than 20% in our healthcare costs each year are attributable to obesity.
Cross-sector work suggests to us opportunities to go beyond what might be normal partnering or normal day-to-day transactional behaviors and engagements, and to reach disciplines, institutions, bodies of knowledge that are beyond, in our case, media and education.
So when we think about the root causes of social disadvantage, because that is related to obesity, and then the causes of the causes, how we get to the point where we're eating too much and not being active enough, that's really spread across, the decisions are spread across a lot of different sectors.
So whether you're from manufacturing, transportation, urban design, education, information technology, this issue around obesity is one's issue.
Simply put, we just won't be effective if we focus our efforts in the medical office building. As soon as our patients walk outside of the medical office building, they are impacted by an environment that makes the healthy choice not necessarily the easy choice.
Philanthropy can't do it by itself. Public health can't do it by itself. Media can't do it by itself. The food and beverage industry cannot do it by itself.
Everyone has a part to play, and we need to think creatively of how that we can synergize those parts to work together for the greater good.
We think having Cookie Monster learn that a cookie is a sometimes food and regulate his behavior, being more patient, is a model that kids, as they adopt, helps.
But at the end of the day, it's about making the case that there is common ground and that there is value in working collectively, again, to achieve what might be different end goals for everybody, but they're all going in the same direction.
The great thing is that all different goals have convergent interests, convergent strategies, and that's where the real juice is.
No one entity has the resources to invest in a singular type of way to address the issue. No one. And so with that, everybody has to come together on this issue. It is solvable. It is solvable. It's complex, but it's solvable. And I believe that.
I will refer all of you to your program booklets, which includes biographies as well as photos of all of the speakers here. It also includes case study backgrounds that supplement the presentations. And for those who are listening on the web, the materials are located at iom.edu/cross-sector under other meeting resources. You can look at the same website ultimately for the presentations and discussions and a written summary of this workshop, which will be published in the coming weeks. There will be opportunities for those in the audience as well as those who are participating through the web to ask questions. You will notice microphones here in the room. For those viewing on the webcast, there is an option on your screen to submit questions. It is now my pleasure to introduce Nico Pronk. Nico's the chair of this planning committee for our workshop. He is an outstanding member of the Roundtable and certainly our tallest member. He is Vice President for Health Management and Chief Science Officer at Health Partners Incorporated. Please join me in welcoming Nico Pronk.